Alrighty. Humbled to be back in the seat on a Sunday. Yeah, time for Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05. By His grace, we are alive. Make no mistake, it's Ultimate Health, your ultimate guide to healthy living. And make no mistake, by His grace, I'm still notoriously naughty by nature. Take some praise from Famia, and we get back into specialized dental care for the elderly. Stick and stay, don't go away. Yeah, indeed, we're grateful. Ultimate Health once again on a Sunday. That one from Famia. So back to business. Yeah, we have fun, but we still get it done on Ultimate Health, Joy 99.7 FM. So 2 weeks ago, we started discussing dental and oral care or oral health priorities for the elderly with our folks from Platinum. They're back again, so we must have done something right. And we knew from the, should I say, response on our lines, there was quite a huge demand in that respect. So we're continuing Geriatric Dentistry. We got in the studio Dr. Novishi Akutu. She's the lead clinician, consultant orthodontist at Platinum Orthodontics and Advanced Dental Care Airport. Don't ask me why it's a mouthful, but that's their territory. Next to her, I have Dr. Dennis Della Apresse. He's a senior resident restorative specialist with Platinum as well. We're delving back into the issues to do with elder care. We know we're living for longer. We also know, we learned last week, many features and characteristics of this particular target group justify the concerns when it comes to their dental care and their dental health. So we're going back into that. If you have any questions, concerns, you can join us. WhatsApp is 055 11 11 997. The phone lines will be activated later. And as you know, we're live on Facebook and YouTube. Platinum Bus, you're welcome.
Thank you.
And Dr. I almost said Daniel. Dennis. Yeah. You have two Dennises there, don't you? You have a Dennis Edu? Oh? No.
Yao.
Yao.
Yes.
He's not Dennis? Okay, all right. I keep on linking him. You're welcome. You haven't been on Ultimate Health before, oh?
Oh, no. I think this is the first time.
This is the first time.
Yes.
You're most welcome.
Thank you.
Right. So last 2 weeks, unfortunately last week, for good reason, we're off air because we had the housing fair at the Achimota Mall. So we're back on the block on dental care for the elderly. Dr. Akutu, can we just summarize what we learned last week? The justification for the focus on the elderly and some of the features and characteristics we talked about last 2 weeks.
Excellent. So in part one, we basically covered the definition of elderly, and we joked a bit about the fact that in dentistry it's thought to be people above the age of 65, but that we needed to really broaden that to anybody who had special dental needs rather than just categorizing, because there are some very, very young 65-year-olds who would not necessarily have the features that we were basically looking to address. And then we spoke at length about some of the things that we know occur more in the elderly. One of the major things was the amount of medications that the elderly take, which can actually lead to dry mouth, and what the causes of dry mouth are. We elaborated on the fact that the saliva is really there to moisten and to protect, and that once there isn't that much saliva, then you get prone to a lot more decay, a lot more caries. So we really focused on a lot on dry mouth. We also focused on root caries, the fact that decay doesn't usually occur around the roots, but in the elderly we see that significantly more often. And then we really almost just touched on gum problems, which we call periodontitis, so inflammation, infection of the gums that usually leads to drifting of the teeth and then eventually tooth loss. So those were the main things that we tackled in the first session.
In part one, right? And my discerning listeners, I call you discerning for a reason and for distinction, right? So I know you're right with us. We learned all that, but you may recall that in, I think it was March, we had them in the studio as well, and we looked at, this whole connection again between oral health and overall general health and well-being, and the mouth being that window that gives us several salient indicators as to your overall health. Let me come to you, Dr. President. I mean, this is an important linkage. We can't emphasize it enough, but can we just link that and then bridge it with the elderly? The link between your overall oral health and well-being and general health.
Okay, so thank you very much. Before I respond to that, let me just take the opportunity to congratulate Dr. Akutu for inspiring us for the past 10 years. She's really set up a practice that creates an environment that promotes clinical excellence, and she's made available all the state-of-the-art equipment that makes us to really practice world-class dentistry here in Ghana. Let me also use the opportunity to say a big thank you to one of my consultants who is listening to us right now, Dr. Gilbert Ankra. He is a gerodontologist and specializes in providing advanced dental care to the elderly.
Wasn't he at some time? Was he president of the association? Or?
Yes.
Yeah.
Yes.
I know
yes.
him. Yeah.
Yes. He was one time.
Right.
Yes. All right.
Dr. Ankara, right.
Yes.
Okay.
Okay. So, as alluded to by my consultant, Dr. Kutu, there's a great link between oral health and general health. And we know, for example, that if you talk about the various structures in the mouth, like the teeth, the gums, and the other supporting structures, if, for example, you have gum disease, that gum disease can have an influence on sugar control, for example. So if, for example, you are diabetic and you are unable to maintain a good oral hygiene and you have inflammation of your gums, that inflammation can result in poor sugar control.
Okay.
Again, we also know that there's a relationship between oral health, the state of one's oral health, and cardiovascular diseases.
Right.
All right. So there's this, bi-directional kind of link that a general health can affect oral health, and oral health can also affect general health.
Okay. 14 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we come alive. I'm in the seat. My name is Nortey by nature, and I've got guests from Platinum Orthodontics and Advanced Dentistry in Airport Hills here in Accra. We had them 2 weeks ago. And, just like Dr. Presser said, we gave them the thumbs up because they chalked 10 years, right? Even if you're doing the wrong thing for 10 years, Charlie, you've been diligent. But if you've been doing the right thing and you've been recognized globally, internationally, then that's something special. We are, partnering with them on this anniversary drive, which they tell us, emphasize that it will cover a whole year, right? It's not a week of, T-shirts and no, it's serious stuff, right? And we'll, mention some of the things they're doing. They're doing a lot of partnership with schools, community work, and other stuff. I'll talk about those things. I do believe, right? They may offer some special cleaning or, complimentary cleaning for 3 older adults. Right, I'm going to insist 65 and above. I am insisting, right? And screening and cleaning. They didn't mean to rhyme, but it does rhyme. All right. So I'm going to also insist that if you are in that category, send us a WhatsApp right now. I would pray and hope you are in Accra or able to be in Accra for the designated times they will be able to offer this. Right. And I'll pray and hope also that you will be able to remember their theme. They gave us a slogan last 2 weeks for their 10th anniversary. Just try it. I might not be too sticky on that, but yeah. So back to the issues. And remember, our WhatsApp is 055 11 11 997. We are live on Facebook and YouTube. All right. We're talking about special care, dental care for the elderly. So you've talked about some of these things, right? Dry mouth. I think last 2 weeks, we talked about their ability to actually hold the toothbrush or whatever, tool properly and manipulate it properly and so on and so forth. We also talked about things, in passing, things like dementia that may mean that you may even forget to look after your teeth and your general health and hygiene anyway. So these are things that we learned last week. But if you have any questions, 055 11 11 997. And this week we are going to focus on geriatrics. I know you have other dental issues that you want to download on them, but I have a way of keeping them captive for longer. So never mind about those ones. Let's focus on geriatric. All right. So coming back, Dr. Akutu. So we talked about some of these things. You emphasized especially dry mouth. Even the ability to produce the saliva, sleeping positions, the use of the air conditioner which you brought in that promotes a dry mouth. The fact that they may even sleep with their mouths open. All right, have we or could we say we've closed the door on that aspect, xerostomia?
I think that it is a huge topic and it does affect a lot of people. So it's the sort of thing that you get a lot of questions on. But honestly, the really important thing is that if you don't have the saliva there to protect you, then you have to do every other thing possible to circumvent that.
Right.
So especially when you're sleeping, the two things that dental professions insist on is that the first thing is that there's an hour between the last thing that enters your mouth, other than water, before you go to sleep. And then the second thing is really pushing for the nighttime brushing, because we are very, very clear. And as a country, I think we're all very good at the morning toothbrushing, but a lot of us are not brushing at night. So we definitely, especially if you've got xerostomia, dry mouth, we definitely want you brushing last thing at night with a fluoridated toothpaste.
Okay.
And the other thing, which we didn't mention, in part one, was the fact that you can have toothpaste that have an increased amount of fluoride.
Okay.
And those are, again, really, really good if you're not producing sufficient saliva, because then we want to actually augment the amount of fluoride that is in your oral cavity.
Okay. How would I know that? Looking at a tube of paste.
So all tubes of pastes have the amount of fluoride per million, and you see this as a ppm.
Okay.
I have to say again, Ghana is really, really great, because worldwide the average amount in most toothpaste is 1,200 parts per million, but a lot of our locally produced or locally available toothpaste have 1,400 parts per million. So that's already good. But then your dentist can prescribe toothpaste with much higher levels. So for example, they can prescribe toothpaste with twice as much, 2,800 parts per million, or even as much as 5,000 parts per million. But this comes as a prescription toothpaste.
All right. So don't just look at the white teeth in the adverts, right? There's specific data you should be looking at on the package. And like Dr. Kutu just said, you need to augment, right, the percentage of fluoride you have in your toothpaste or your chosen or preferred toothpaste, depending on the conditions and indications, right? So that's a good thing to learn. So we have some of these things that we can do something about. You talked a lot about medications in linkage with, dry mouth. So for some reason, I'm in this age category. I am bound to take certain prescribed medications, typically for long periods, if not for the rest of my life. Right. So all these things you're saying about drinking water, making sure that nighttime brushing and other things, even morning brushing, all these things are, maintained. Is there anything else I should be doing?
So I think that in this age group, we know that up to 80% of them are on more than 4 medications.
Okay.
And some of these medications interact. And I think that we are very used to getting a prescription here, a prescription there. But at least once a year, you should be sitting with one medical person and actually going through the medications that have been prescribed.
Okay.
Firstly, to see whether you do still need them, and then to look for interactions between those medications and to try and see whether other medications could be substituted if this becomes an issue.
Right. Okay, great stuff. 21 minutes past your hour of 2 on Joy 99.7 FM. We're talking about dental care for the elderly with our guests from Platinum Orthodontics and Advanced Dentistry, Airport Hills. They are 10 years old, and that in clinical practice is not a kid. It's not a child, right? So we congratulate them. Then we continue, of course, what we started 2 weeks ago. And those of you who suddenly appear, when you hear Nortey mention something free or complimentary, I will be looking at you, down my nose. This one says, good afternoon, N by N is Nortey by nature. Okay. Will be 65 in August. You see, I know my folks. 65 in August. You want to, as they say in Ghanaian parlance, breast the tape. The race has not started. Wait. Okay, but I'm glad you've gotten the specification I've given you, because we don't want to stray. We want the right people to benefit. We'll see if, we can screw some more stuff for different categories from Platinum, so that we get stuff from them. And so, 65 in August. Will that do? Well, keep your mouth open. Get it dry enough. We might consider you. I'm kidding. All right. This one says, I'm 65 already. See what I mean? Okay. I'm 65 already. Hi. No name. Nothing. they're 65. Now people are happy to be 65. Eh? I should scroll up for the name. Oh, I can see Felicia. All right, Felicia. All right, congrats to you for being 65. And let's see, you know, Abeku and I have ways and means. He's the electoral commissioner. So yeah, back to the business. Okay, so those things are things you can have consultations about with your prescriber, and of course, when you get to the dentist as well, with your practitioner and provider at the dental clinic. Right. Were you going to add something?
Yes. So whilst we talk about dry mouth, we also look at the other spectrum where people could actually have excess saliva production.
Okay.
And just to re-emphasize the point that the elderly, we have different age, categorizations. So we have the young old, which would usually be between 60 to 69 years.
You're just insistent on adding me.
And then
I refuse.
And then we have the the middle old, that's between 70 to 79, and then 80 plus is the old.
Okay.
And so we need to look at these categorizations, and the fact that the experience differs as you move from one category to another. And back to the issue of saliva, we know that amongst the elderly, there are a lot of things that go on in terms of their physiology, and as Dr. Kutu also alluded to, you have them on several medications, and that can also cause them to produce excess saliva.
Okay.
Now, it's not just an issue about producing excess saliva, but as to whether the saliva that is produced would also, be swallowed. Because if the individual is unable to swallow the saliva, then it collects in the mouth, and sometimes at bedtime when you are asleep, you tend to have drooling, or even sometimes whilst you are awake, you could still drool, or if you have problems with controlling of your lips, which is something that occurs a lot amongst the elderly, then you're going to have problems with drooling, and it's a very common problem that that we see in our practices.
I'm looking at you because a lot of people say, "Yo, Anuncio, it's like, well, I'm asleep, I'm not awake, I'm not accountable, so drooling should not be something that I get a yellow card or even a red card for." Can you, especially with this group, isn't there some mode or amount or of drooling that we can say is okay, it's normal, or we shouldn't drool at all when we sleep?
So usually we shouldn't drool, but sometimes our posture whilst we are asleep can also influence that.
All right.
But specifically amongst the elderly, it's about the fact that most of them have issues with muscular control, and so they are not able to get to swallow because the tongue helps us to swallow.
All right.
So if you produce saliva in your mouth and you're unable to swallow, it collects in the mouth. And if your posture at night is not good, you're going to end up drooling. Okay, so that's yeah.
Okay, so folks, it's good to understand these things because we're talking about a specific group, right? And therefore, you can now appreciate some of these challenges. Not only have I got saliva in my mouth, which I don't want, my ability and capacity to evacuate that is challenged. I may be post-stroke, post-whatever, and so on and so forth. And therefore, my ability to even do all these things we take for granted is compromised.
Yes, and I have to say, with the excessive saliva, it's usually the clients who will present.
Okay.
And you find that for some reason, it can be very debilitating to them. So, in all other aspects, they feel as though they are coping, but as they sit there, even if it's lunchtime, then you can see this excessive saliva, which they're always having to dab away, etc.
Okay.
And there are ways of treating it. One of the more common ways of treating it is actually with Botox. And I like to mention that because I think everybody now associates Botox with facial aesthetics. But this is one of the major ways of treating it. And it is usually done by a radiologist, though.
Okay.
So you use an ultrasound to basically go into or find the nerves and the salivary places. glands, and then you can inject Botox there. But then there are also ways where you can literally tie off, because the saliva is made and then it goes through what might as well be a water hose into the mouth.
Okay.
So you can't tie off some of the hoses if it becomes so debilitating
Right.
for the individual.
Okay. And so that's a surgical procedure.
Yes, but relatively minor
Okay.
surgery.
Yeah, but we also have non-surgical procedures. So we have speech and occupational therapists who can really train you to be able to control, your muscular movements,
Okay.
and also be able to give you a posture that would encourage swallowing of your saliva.
Right.
Okay, there are also medications that can be given to reduce the flow of saliva. And so there are conservative, approaches as well as surgical, approaches.
Okay,
So-
great start. 29 minutes past the hour of 2, Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. We're talking about special dental care for the elderly with our friends from Platinum Orthodontics and Advanced Dentistry in Airport Hills. They are celebrating their 10th anniversary, and we're partnering with them some way. You know how we do it in Ghana, to educate you, to inform and transform your understanding of some of the critical issues, and your own voluntary patronage, not the ones that are complimentary and free, of dental services, not just at Platinum, but across and generally. That's what we're doing as part of our, piggyback that we're giving them for their 10th anniversary. They're also giving us a piggyback today specifically. In fact, I should allow it to come from you because I've said it. You did hint that you may or you have some complimentary offer, right? I've done it in a way that you can't say no.
Yes.
What's on the table?
So basically, we are asking Joy FM and this group to pick 3 lucky listeners.
When Abeku and I are here, you ask us.
To pick 3 lucky listeners to come and have a free registration, free consultation, and a free cleaning at our facility. We're hoping that you can make it for Friday the 26th of July, but if not, we will work with you to get it in. But we are insisting that it is the elderly
All right.
for this particular offer.
Okay, folks, please, complimentary cleaning and screening. So they will go through your mouth. If they see anything, they'll tell you. All right, and they'll still do a clean. And clean is not the one you do at home. All right, this professional, qualified cleaning that will be done for you on a specific day. She's mentioned the 26th of July, right? That they can do that, and they stick to their times as well. So we'll give out those details in a bit, so that you understand that. I'm seeing people. Next, I'll see somebody's birth certificate. I'm telling you. This says, "Good afternoon, Nortey. Please, last time I asked about where is it? The bitterness in the mouth, but you didn't explain what causes it. Why am I supposed to explain it? That's why I bring my guest. Is it the lack of saliva in the mouth that causes it? I'm 60 years plus. Is it hetty or hefty? Right? That's an open question, right? But bitterness in the mouth. I don't want us to deviate, but this person is 60. Bitterness in the mouth.
All right. So it's also a very common presentation. I think that one of the most important reasons why you may have this is poor oral hygiene. So if you're not able to keep good oral hygiene, brush the surface of your tongue.
Okay.
And here I have a model here.
All right.
And you have the tongue there. And what happens is anytime you eat or when you take medications, whatever goes into the mouth actually gets to coat the surface of the tongue.
Okay.
And if you are not able to clean the surface of the tongue very well, these then affects the way that you taste, because you have taste buds on your tongue, and this can affect the way that you taste, and you might end up having this sensation of bitterness.
Okay.
So that's the first thing that I would talk about.
Right.
Again,
so you're not brushing properly.
Yes, and then of course after brushing our teeth we are supposed to brush the surface of our tongue to make sure that if you have any food deposits on the surface of the tongue, you're able to clean it up.
All right.
Of course, we also know that infections can also result in bitterness.
Okay.
Medications that we are taking, we know that acid reflux disease, when you have acid coming back from your tummy into your mouth, that can also lead to bitterness in your mouth. So there are myriads of reasons why you may have bitterness in the mouth. So you need to come for us
needs to be properly investigated.
To properly, investigate it.
Okie dokie. I think that was Edward. I hope that's answered for you. This was the business one. Let me just quickly click. Oh no, this is Hefty, right? I'm tempted to believe it could be Hetty, right? My mom's name. Good afternoon, Nortey. Last time. Okay, this is Edward Osei. Oh, what's Azabeku doing? Are you fighting me? All right. Edward Osei, listening to you from Bawe Bulemin. Bawe. Let me say Bawe. I'm not 65 plus, but I just need the direct and phone number of the dentist location so I can go there and have my teeth checked. Please, I just need help for my mouth. You'll get it because, the numbers, we'll give out their numbers, okay? I'm a bit funny when it comes to my guests and their numbers, but I know last week we even put up their photo frame which had their number. So we'll do that for you. All right? Okay, so you got the help you needed for your mouth. This one says, I'm 74 years. Aite Ajine. That's all. Finish. Agbena. His age and his name. Love that. All right. This one says, Doc, please consider me. I'm 65 already. My name is Felicia Apeto. Consider me. All right. Okay. Abeku, please note all these down. We'll put them into some special oral draw. Okay. I feel I have dry stuff impacted in my upper gum around the incisors and molars. See a dentist if you want, if you wish, if you prefer. You can go to Platinum. They are on the same road as Lister Hospital, Airport Hills, Finale Drive. Okay. Doesn't mean you have to drive there, but go there. Okay. There's more. Wow. Okay, this person is still typing. Alice. Oh, no, Felicia Peto. Oh, Felicia. You are rigging the election. All right, let's come back to business. So we've understood that, all right? Many things can cause bitterness. Many things can cause dryness, all right? Yeah. We did a bit of stuff last 2 weeks on gum disease. Is there anything we want to add? And I'll come to you again because you're a senior restorative specialist. Yeah. You restore.
Yes.
Okay? And so we need to get into your territory as well. Anytime there's anything that touches or impacts on your territory, let me know so that I don't miss the bus.
Okay.
All right. So gum disease for the elderly. We talked about tall teeth. I'm remembering all the stuff. When the gum has receded and now you're seeing more of the teeth that you shouldn't see and you shouldn't feel, and now you're feeling stuff. So yes, gum disease.
So gum disease in the elderly really is bone loss. It shouldn't be there, but it's very, very common. And once it's not controlled, what basically starts to happen, and the way that I like to describe it is that imagine a tree, and a tree has roots, and it should have sand around it. Okay. And once the sand starts to go away and be pushed aside, the tooth is still there and the roots is still there. But now if there's any wind or any pressure, then it starts to drift and it starts to move in a specific direction.
Which it shouldn't.
Okay. So the more of the foundation, the more of the bone that is actually lost, then the more the teeth tend to drift. And they'll drift and drift and drift until they in effect drift out of the mouth. And then now you have a missing tooth. But the important thing is that once this has happened to one tooth, there's a very, very high probability that it's occurring in multiple sites in your mouth.
Okay.
So again, the regular checkups are really, really important for this age group. And these are the age groups that actually present to us less or least. But it's really important because making sure that we are in making sure that we are not losing any bone is really important, because once the bone is lost, number one, it cannot be replaced, and then number two, you're now having to do relatively complex work,
right.
And also introducing foreign objects into the mouth, that their age means that it's less likely that they're going to adapt easily to. So you get caught up in this vicious cycle. But once the tooth is lost, or even before that, we tend to pass you on to the restorative specialist, who have a critical role in not only restoring but maintaining. And then once it's lost, then they really have to look at the different ways of replacing the missing teeth to ensure that you can still function and eat properly.
All right. So you're looking at that. It's serious stuff, eh? And for those of you listening to me, yes, I will activate the phone line. And we're still live on Facebook and YouTube. For those of you listening to me who have been compelled to chew on one side or one part because of some of these problems, it means that, you shut down a part of your mouth, and it's not part of your operations at all. You've done load shedding in that area of your mouth. Dr. Presa, you're looking at me and nodding. Were you confessing to chewing on one side?
Yes.
Oh, you of all people.
No, I think
you didn't fix yourself.
There are a lot of my clients who...
Let me just announce the phone lines here. I tend not to shut out my guests, my listeners. 030-221-6541. 030-221-6541. WhatsApp is still 055-1111-997. Right? And please, I know you want to actually call out your age and your date of birth, but go to your questions as well. And if you can, do it by WhatsApp, and then Abeku and I can do a draw. Yes, sir.
All right. So one of the things I want to talk about is that the aging process, tells a lot on us. I'm sure that if you were to compare your photograph when you were 10 years to 30 years to 50 years.
Leave me out of this.
you would have noticed that there have been a lot of changes that have gone on, and the same thing happens in our mouth. So the teeth, the gums, together with the other structures, undergo several changes as we grow old.
Okay.
And I wish to also bring to the attention of our listeners that as we discuss the teeth, we need to realize that it works within a system. So we are not just talking about the teeth, but we're also talking about the other parts of the orofacial structures that helps us to function.
Okay.
So we have the teeth, which are embedded in the jaws, and then we also have the muscles. These muscles helps to generate the kind of forces that we require when we are chewing. And then we also have the joints, which we call the temporomandibular joints, which also helps us to open our mouth and make movements that helps us to be able to function. It is important that all these components work in harmony in order for us to be able to experience good oral health. So I'll just give an example that if you wanted to bite into a piece of chicken bone and you place the bone in between your teeth, the first thing that's going to happen is that your teeth are going to make contact with the bone.
Okay.
But then around the teeth, there are some fibers that will help you to be able to determine how hard this bone is. And there's a reflex action which instructs the muscles to tell the muscles that, look, you need to contract by this amount of force in order to be able to crush that bone.
Wow.
And if the force that is generated is too much, there are two things that can happen. Either the bone crashes or your tooth crashes. And that's why sometimes we have tooth fractures, or someone will be chewing something and say, oh, I've broken a tooth. And so it's important for us to understand how all of these work together to make us function.
Okay, a whole structure or orchestra of muscles, tendons, nerves, and things. But can't you override this message which says bite by this mechanism? I mean, I want to chew the thing, my friend, and then I go ahead. That is when I get into trouble.
Yes.
Okie dokie. Folks, I've just found the number. Yeah, they got me to take a picture last week. 0302 998-750 0302-998-750. I believe that will put you in touch with all these oral terrorists. Yeah, but they do a lot of good work in your interest. My phone line is active 030-221-6541 030-221-6541. Ultimate Health on Joy 99.7 FM. With me, yeah, I still have I have some cavity, some gaps. Nortey by nature, I got some teeth and they do good work, but I'm so afraid of going to these people. I will never let them, they'll bully me. They'll make too much money. I'd rather lose all of them. Yes, but we're also talking about losing your teeth in your old age and the challenges with that as well. We've got a restorative specialist in the studio in the person of Dr. Dennis Della Aprese. He's with Platinum, and lead clinician and head honcho and chief terrorist, Dr. Novishi Akutu. She's a consultant specialist orthodontist. Am I right? Mm-hmm. Yep. Okie dokie. You do all the alignment and balancing and all that. Mm-hmm. We might get to that as well. They're celebrating their 10th anniversary. They're doing lots of stuff, and I'll quickly share some of them in a mo. So with that, we looked at the gum disease. Of course, if there's gum disease in progress, then you have to intervene.
Yeah, so we do, and that's quite a gradual thing. And there's another specialty that deals with that, and they're called periodontists.
Right.
And you often hear the periodontists saying to their clients that gum disease is a bit like diabetes in that it's a chronic disease that needs to be managed. And it's not something that there is active cure for, but rather you're trying to manage the actual process. But I do think that one of the things with the elderly is how much to do. And I feel that even as a dentist, sometimes we give all of the options, but even when we know which way they should be going, you are always not, a lot of the time, you're not just treating the elderly, you're also treating the family that come along with the elderly.
Caregivers.
Yeah, and you end up with a group of people who are making decisions. And one of the decisions that always come into play, other than finances, is how long are we actually looking at prolonging things for? And I do think that our attitude to this needs to change, because allegedly 1 in 4 of us is going to live past 100. So considering there are almost five of us in this room, one of us is going to live past 100.
Past 100 doing what? Come on. Come on.
Yeah.
What am I doing at 100?
Yeah, and this is what we need to realize, because whether we like it or not, there are going to be so many elderly people, and the experience that any medical, area has in treating such a large amount of elderly people is coming from experience, and we having to learn as we go along.
Okay.
So a lot of the time we have an elderly person in the chair, and they have lost 2 or more of their teeth, and it's affecting the way that they actually chew.
Right.
And we have a range of ways of replacing the teeth, some of which are significantly more successful and easier, but they are also sometimes a little bit more invasive.
Right.
And you're always having to balance how invasive you want to be and how much function you actually want them to be able to have.
Okay.
But where I feel we get caught is that you make a conservative decision, and then 15 years down the line, or for us now, 10 years down the line, they come back, and now you're thinking, should I have done the more invasive thing that would have lasted the next 30 to 40 years?
Okay.
So we also, as professionals, are having to rethink how we recommend things and what we actually advise our clients of.
Great stuff. Talking of clients, I have a caller on the line. Do I still have the caller, Abeku? Yep. Okay. Hello.
Hello.
Hi. Good afternoon. Who am I speaking to?
I am Delphinos.
Delphinos. Okay. You sent a message. Thanks for holding on, and please share with us.
Yeah, I have a drooling problem. Yeah, and apart from that, I've also lost 2 of my lower teeth.
Okay. And you shared with me on WhatsApp. I'm trying to scroll back to that. But how old are you?
I'll be 17 December.
Right. Okay. Yes. This is Delphinus. He says almost 70, and I have a challenge with drooling. Delphinus Nodo. He's speaking to us now. Doc, anything to say to that? He's lost a couple of teeth, lower teeth. He says.
Yes. So.
And he has the challenge with drooling, saliva.
Good. So of course we spoke earlier about drooling. That it could be because he's producing excess saliva. Number 2, it could be that the saliva is being produced, but he is unable to swallow the saliva, and that's a function of the tongue. or he's unable to control the lips properly,
All right.
and that can also result in that. I think that if he comes, we could be able to assess and see exactly which of these might be the reason why he's having the and like we said, there are various strategies to deal with it.
Okay.
You could have a speech therapist who can help him to be able to control his lips.
Yep.
And also the tongue, so that you'll be able to swallow the saliva.
Okay.
And then we have medications that can also be given to to
Great
control.
stuff. In that
Then
just a second. In
Okay.
that same. Oh, sorry. Let me let you finish. Yeah.
yes, and then he also spoke about having lost some teeth.
Yeah.
Yes, so there are various ways by which we can help him. So we have removable options, okay, which we call removable dentures.
Right.
So he can be able to fix them in and remove them, clean them, and then fix them back.
Okay.
Then we also have fixed options like the dental bridges, where we need to use some of his teeth as pillars to hold the teeth that are missing.
Okay.
And of course, we have the dental implants as well. So there are various strategies that we can use to replace those missing teeth.
Okay,
Yeah.
Delphinus, thanks for sharing and throwing light on this area for us to use as an illustration. He also wanted to wish senior journalist Malik Kweku Baku Jr. a happy 70th birthday. You can still be called Junior at 70. Right, we still got time for questions, concerns, experiences, confessions. Dental care for the elderly. It is a serious, serious area. In fact, in some of my reading, I came across it as a silent epidemic that we don't pay too much attention to it, but it's building up. The numbers are and the demographics are building up, and we need to have, should I say, targeted, tailored services and interventions for them to make them comfortable. Many of them will come to practices in all sorts of modes. Some have lost the capacity to even move around themselves. They may be carried to facilities. I do recall 2 weeks ago Dr. Akutu sharing with me that they have, should I say, elderly or age-friendly settings, and they do go the extra mile to accommodate the needs of this particular target group. Those of you who are sending me stuff and your ages and all that, we've given ourselves work. Righty. Thanks, Nortey and Docs, for the good work. I listened to part 1. Thanks for the part 2. I noticed some cracks towards the tip of my tongue. It doesn't bleed except, oops, who's fighting with me and scrolling? Except when I brush hard on it. Lately, I have a funny feeling in my mouth and on that part of my tongue, as if I've just got burned from sipping something very hot. I intend to go see a dentist, but any idea what this could be? This is from RJ in the US. So there's a burning sensation on the tip of the tongue. He seems to see or perceive some cracks at the tip of the tongue. It does not bleed except when he brushes a bit harder or harshly.
Okay, so the tongue tends to change a lot, even month to month. But one of the things that we definitely know is that looking at the tongue, you can pick up some deficiencies. And the deficiencies that usually present this way is vitamin B12, folate, and when people are a bit anemic.
He sent a picture as well.
Okay.
Yeah.
And when people are a bit anemic. And so usually we would say get some blood work done to actually check. And then there is the tongue has grooves in it or fissures, and sometimes those fissures become deeper. And once they become deeper, it gets harder to actually clean them. Please remember when you're cleaning your tongue that we are asking you to do it gently and to use a soft brush or even gauze or cotton wool rather than scrubbing. Because the more scrubbing you do, especially with a hard toothbrush, then you are going to actually or could have the potential of causing more damage, and then the grooves become deeper and deeper. The photo we are looking at looks very, very much just like a deep fissure. But the other other thing that happens a lot when people get a burning sensation is another thing which is known as geographic tongue. But that usually occurs as red patches, which are very, very smooth, and that occur in various parts of the mouth.
Okay.
So those are the usual factors. Vitamin or mineral deficiencies, deep fissures that's leading to some inflammation, and or geographic tongue, which is not something that a lot of people have, but relatively benign, and we just usually treat the symptoms with that.
Okay, great stuff. I have a caller on the line. Let me quickly slip that in. Hello.
Hey, good afternoon.
Afternoon. Who am I speaking to?
I'm Nana.
Nana, where are you calling from?
Medina.
Okay, go ahead. Share with us quickly.
Okay, so I brush twice a day. Last night when I go to bed, I can't brush every night. However, sometimes the teeth become sensitive. In the Canada, I do the more on them. So what could be the cause? And also about brushing teeth twice. Please, before you.
Nana, hang on a sec. Slow down. There's a lot of background noise. Okay. Yeah. We heard that you brush your teeth twice.
Yes, I
What-
brush twice a day.
Yeah. Then
I change brush every month.
you change your brush every month.
Every month, yes.
Okay.
However, sometimes the teeth become sensitive in the corner there.
Your teeth become sensitive in the corner.
Yes. Sometimes.
Okay. And you want to know why?
Yes, what could be some of the possible causes?
Okay. Thank you. We'll try and get answers to that. Sensitivity when he
Yes.
brushes regularly, changes his brushes
Yes.
monthly.
Yes, so sensitivity may be due to a number of factors, but we need to understand what results in teeth sensitivity. We know that the outer layer of the tooth, the enamel, is what protects the tooth, and under the enamel we have the dentin, and the dentin has nerves. Okay, and so whenever the dentin is exposed, then you are most likely to have sensitive teeth. And usually the sensitivity may be caused by either wearing of the tooth surface by toothbrush, vigorous brushing of teeth. So we need to know, for example, the type of toothbrush that he's using. He may be using a very hard bristle toothbrush, which can wear off the enamel and expose the dentin. Sometimes drinking of carbonated drinks can cause chemical erosion of the teeth. And that erosion would also lead to the exposure of dentin, and that would also result in dentin sensitivity.
Okay.
Yeah.
I want to know the prices of the replacement of teeth your guest just talked about, because I want my mom to replace hers, and she's 63 years old. Jijo from Dodua. Pocho Baku saying.
I think that
just approximate ranges. What are we talking about? Is it possible to do that?
It's not very possible to mention prices because there are a lot of factors that go into replacement of teeth. So we need to look at the condition of the mouth. We need to look at the number of teeth that are missing. We need to even look at the type of replacement that will be ideal and suitable for that particular mouth. And based on that assessment, we can be able to give some price.
Okay, in a nice way. Get yourself an assessment or some kind of consultation, and then you can think about it. Because somebody might offer you something which sounds cheaper, but maybe deadly, right? I said that. They didn't. Yes, Dr. Akutu.
So whilst we were talking about the tongue, there was one thing that I didn't mention, which affects this group more than other groups, and that has to do with oral cancer. So we've got very used to
just by way of emphasis. When Doc Akutu says this group, we're talking about the elderly. Many of you came to class late and you've heard dentist, and then you are derailing us. She's talking about the elderly, 65 plus, but she may go lower to 60. Yes, go ahead, please.
Yes. So Oral cancer shows up particularly in this group. And this is why dentists are always pushing for 6 monthly checkups. Go for your checkups, even if everything seems fine. Because one of the things that we always do is to screen for oral cancer. And even I, as a dentist, I'm always a bit relieved when I hear oral cancer screen clear, because that just makes you, aware of the fact that that screening has been done. And a lot of the time, it's very, very simple in your mouth. If you have what appears to be an ulcer that has not healed within 2 weeks, you need to go and see a dentist. And this you need to consider urgent, because like all cancers, the sooner it's diagnosed and dealt with, the better. So the message that we're putting out there is that anything that appears like an ulcer that has not healed within 2 weeks should be an alert sign for you to go and see a dentist as soon as possible.
Okay, so all your concoctions, your leaves, your mouthwashes and stuff like that, please get it checked, right? And get it checked at the right place.
Yes, and actually some of the concoction, so even if we leave this continent and we go to Asia and India, we know that things like betel quid chewing, etc., even promotes oral cancers rather than reduces them. So please get to a dentist if you have an ulcer that is not healing.
Okay, and I will whisper that the menu I have with these guys is very, very expansive. I'd set aside the oral cancers and a few other things, but I'm glad it's been mentioned, and we'll get to take a look at that, because that's also very serious as the other things. My name is Nana. My brush is medium bristle. And is there a soft bristle brush? If yes, recommend. Just quickly on the those categorizations: bristle,
yes,
hard, medium, whatever.
Yes, so we have soft bristled, toothbrushes, medium and hard. We recommend soft to medium bristles.
Doc, some people think those are for the lazy people.
No. So we expect that the brush will be very gentle on the teeth and the gums, so they don't cause wear of the teeth and gum recession. Okay. Yes. So we recommend soft bristles. We will not mention any particular brand, but if you get to any pharmacy or supermarket, you will find out that it's written on it soft. Okay. And I think that
we also need to be we also need to be aware of the amount of pressure that is being applied independent of the brush. Okay. So we need to remember that we're not meant to have a fist grip. We are meant to pick the brush up almost the same way you'd pick up a pen, so that you're actually using your finger pressure rather than your whole fist. Okay. And for this particular caller, the recommendation is to change your brush every 3 months. So if your brush is already looking frayed after a month and you are changing every month, that almost leads me to believe that there may be too much pressure being applied. So independent of whether it's medium, if you're applying too much pressure, then you're still going to wear away that protective enamel.
Okay, so you may be doing macho stuff on your teeth, irrespective of the categorization of the brush you're using, right? Take it easy, okay? Take it easy. I'm sure you're looking to woo some particular chick. That's why you are brushing plenty and changing your brushes like that. We are out of time, but let me just quickly allow myself some, leeway to slip this in. You guys are doing a lot of stuff. You mentioned a lot of partnership work with children in schools, but I'm hearing some hearing some snippets about something you want to do at the Flower Pot Roundabout? Can we quickly in a minute just mention this?
Yes, so we're asking all of your listeners, especially those who live in the Flower Pot area of Spintex, who live in Jowolu, and who live in the Burma Camp
Flower
area.
Pot is where we're doing the intersection, the overhead and all that.
Yes. Yeah? So from basically our actual neighborhood, and then Burma Camp, and then Jowolu, to please follow us on our social handles, which is Platinum Dental Services. We have some exciting things that are coming up, and this time we are focusing on the other extreme. So there's a lot of focus on children, and we're doing some amazing outreaches which are promising to be really fun and entertaining whilst doing dental education as well. So follow us on our social handles, Platinum Dental Services, to keep up to date as to what's happening. But the hint is that it's likely to begin end of July to first week of August.
You're not putting some giant teeth at the roundabout, are you? It's not a giant tooth or a giant toothbrush. All right, folks, you heard it here on Joy 99.7 FM, but it's still all education, information, transformation, and empowerment, especially or particularly, emphatically, when it comes to your oral hygiene and your oral health. I've been speaking to the folks from Platinum Orthodontics and Advanced Dentistry in Airport Hills. They are still in a celebration mood. When they are sharing money, I'll tell you. Those of you who've indicated your names and your ages, I bet who will find some mechanism alongside myself to select 3 of you. Mind you, if we do select you, you will have to be available on Friday, the 26th of July, around midday. Okay, and they will contact you through whatever mechanism we put up. Those of you who generally wanted to reach out to Platinum 0302 998 750, I mentioned that earlier, 0302 998 750. So they should be on the end of the phone. If they're not, then they're probably nibbling something, but they'll get to you. Okie dokie, we're out of time. I'm sure there's some sports or other things coming up on Joy 99.7 FM. Many thanks to you, my discerning listeners, and of course, my producer Abe Kusan Kofi, and many thanks to Dr. Akutu and Dr. Aprese and all the lovely people they have at Platinum. And we'll be keeping an eye on you guys. That's my old headmaster used to say. I got my eyes on you, right? We'll be looking out for you. Stick and stay on Joy 99.7 FM. My name is Nortey by nature. I'm out.
Joy 99.7.